Are you overwhelmed by stress and looking for peace? Everybody is looking for a way to find peace in their hectic lives. Discover the transformative power of mindfulness, a practice that enhances mental clarity and emotional well-being by focusing on the present moment. Integrate mindfulness into everyday life, offering a pathway to reduce stress and increase joy. Mindfulness is the practice of purposely focusing one's attention on the present moment and accepting it without judgment. It is now being examined scientifically and is a critical element of stress reduction and happiness. Mindfulness has roots in Buddhism, and most religions include some form of prayer or meditation technique that helps shift our focus from our usual preoccupations to an appreciation of the moment and a broader perspective on life. Fundamentally, mindfulness is the essential human ability to be fully present, aware of where we are and what we're doing, and not overly reactive or overwhelmed by what's happening around us. Here are 4 mindfulness exercises and an easy way to meditate. Mindfulness is not obscure or exotic. It's familiar because it's what we already do and how we already are. It takes many shapes and goes by many names. Mindfulness is not a special added thing we do. We already can be present, and it does not require us to change who we are. However, we can cultivate these innate qualities with simple practices that have been scientifically demonstrated to benefit ourselves, our loved ones, our friends and neighbors, the people we work with, and the institutions and organizations we participate in. Mindfulness does not require you to change. Solutions that ask us to change who we are or become something we are not have failed us repeatedly. Mindfulness recognizes and cultivates the best of who we are as human beings. Anyone can be mindful. Mindfulness practice cultivates universal human qualities and does not require anyone to change their beliefs. Everyone can benefit, and it is easy to learn. Mindfulness is a way of living. In daily life, a psychotherapist would emphasize that mindfulness is both a formal practice and an approach to everyday life. Clients can learn to apply mindfulness to daily activities such as eating, walking, or conversation, practicing being fully engaged and present in the current experience. Mindfulness practices have been researched and have shown benefits in reducing symptoms of various conditions such as anxiety, depression, and PTSD. As therapists, it is crucial to understand and effectively communicate the core elements of mindfulness to our clients. Mindfulness is a practice and an experiential process that nurtures awareness, presence, and acceptance. Here is how you might explain these core elements to therapists who are seeking to integrate mindfulness techniques into their therapeutic work. Duration and commitment. Mindfulness is an accumulative practice. The more consistently it is applied, the more profound the outcomes. Encouraging clients to begin with manageable segments, such as 20 minutes per day, can foster a routine without overwhelming them. As their mindfulness skill deepens, they might be inclined to extend this duration to 45 minutes or more, aiming for daily practice to yield significant psychological benefits. Flow and non-judgment. During mindfulness exercises, guide clients to anchor their focus and observe the stream of inner thoughts, emotions, and bodily sensations without attaching labels or judgments. This cultivates a non-reactive mental space where experiences are acknowledged, but not classified as positive or negative. Attentive awareness. The essence of mindfulness is in paying attention to the present moment. Teach therapists to help clients notice the array of external stimuli, sounds, sights, tactile sensations, and to observe the rise and fall of phenomena within the mind without attachment. This practice is not about avoiding thoughts of the past or future, but acknowledging their presence and letting them pass without engagement. Acceptance. Practice. Encourage therapists to emphasize the importance of acceptance in mindfulness. Acceptance here refers to the openness to experiences during meditation, translating to a more accepting attitude toward daily life events. It is about cultivating a stance of kindness and forgiveness towards oneself, which is a critical aspect of mental health. Redirecting attention. A common hurdle in mindfulness is distraction. When a client's mind wanders, it is essential to guide them in noticing this gently and without self-criticism. teach therapists to instruct clients on how to kindly redirect their focus back to the present moment, whether it be their breath, a sensation, or simply the act of sitting. Persistence and resilience. While mindfulness can sometimes be challenging, consistent practice can unlock a more profound sense of contentment and self-awareness. Clients should be encouraged to persist, even when it seems complicated, and to return to practice after missed sessions without continually self-reproaching. Adaptability. Lastly, emphasize mindfulness's adaptability. Remind therapists that while a structured practice is beneficial, mindfulness can also be woven into daily activities, helping clients maintain a centered presence throughout their day. By instilling these core principles in therapists, they can more effectively support their clients in cultivating a mindfulness practice that enhances therapeutic outcomes and fosters lasting change. In psychotherapy, we acknowledge mindfulness's profound benefits to the mind and body. It is not merely a practice, but a transformative discipline that enriches mental health and fosters resilience. Facilitating joy and engagement. Amplification of life's pleasures. By cultivating mindfulness, individuals learn to savor the richness of the present moment, enhancing their ability to experience joy in everyday activities. Full engagement in the present. Mindfulness trains individuals to immerse themselves deeply in their current activities, leading to heightened performance and satisfaction. Resilience against adversity. Developing a mindful approach equips individuals with robust coping mechanisms to navigate life's challenges more effectively. Mindfulness as a psychological anchor, mitigating future-focused anxiety. Through mindfulness, individuals are less likely to become entangled by anxiety about what is yet to come, remaining anchored in the present. Releasing past regrets. A mindful approach encourages letting go of past grievances and regrets, fostering a state of forgiveness and acceptance, elevating self-perception and interpersonal connections. Mindfulness allows for cultivating more authentic and deeper relationships by reducing preoccupations with achievement and self-worth. Mindfulness in physical health stress alleviation. Regular mindfulness practice has been shown to reduce the physiological effects of stress, promoting relaxation and overall well-being. Cardiovascular health. There is promising evidence to suggest mindfulness interventions can benefit heart health, potentially influencing heart disease outcomes. Blood pressure regulation. Engaging in mindfulness activities can contribute to lower blood pressure, which is pivotal in maintaining cardiovascular health. Chronic pain management. Mindfulness meditation can alter the perception of pain, enhancing the quality of life for those with chronic pain conditions. Sleep quality improvement. Mindfulness can break the cycle of sleep-disturbing ruminations, leading to improved sleep patterns. Gastrointestinal health support. Mindfulness techniques can provide a complementary approach to alleviating symptoms for those with gastrointestinal distress. Mindfulness as a therapeutic intervention. Broad-spectrum psychotherapy integration. Mindfulness is a versatile tool within psychotherapy, aiding in the treatment of an array of conditions, including depression, substance abuse, eating disorders, couples conflicts, anxiety disorders, and obsessive-compulsive disorder. Recent research highlights several benefits of mindfulness in psychotherapy, emphasizing its efficacy in enhancing mental health and cognitive functioning. Mental health improvements. Mindfulness-based interventions, such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, have been found effective in alleviating symptoms of anxiety, depression, and stress. These interventions help individuals by improving their ability to regulate emotions and reducing symptoms of psychological distress. Cognitive benefits. Research suggests mindfulness practices enhance cognitive functions, including attention, memory, and executive functioning. For example, mindfulness meditation has improved attentional capacities, working memory, and critical functions in our daily cognitive tasks. Neurological impact neuroimaging studies have demonstrated that mindfulness practices can change brain regions associated with emotion regulation and cognitive processes. These changes are believed to contribute to reduced symptoms of mental disorders and improved emotional well-being. Cost effectiveness. Mindfulness interventions have also been evaluated for their cost effectiveness compared to other therapeutic interventions like cognitive behavioral therapy. Findings suggest that mindfulness therapies can be a cost-effective alternative, providing substantial health benefits at a relatively low cost. Broader applicability. The application of mindfulness in psychotherapy extends beyond clinical populations. It has also benefited individuals in non-clinical settings, enhancing overall well-being and resilience against stress. Mindfulness is defined as the intentional focus on the present moment without judgment, with its roots in Buddhism and its principles found across various religions. It is recognized for improving mental health and fostering a sense of well-being by focusing on present experiences over preoccupations. Mindfulness is described not only as a meditative activity, but also as a lifestyle that incorporates awareness into daily routines, thereby reducing stress and enhancing quality of life. It is accessible to everyone and does not necessitate any changes in personal beliefs or identities. The document outlines several practical mindfulness exercises, including mindful breathing, body scans, and attentive listening, which help center the mind and enhance awareness of bodily sensations and environmental sounds. These exercises are particularly beneficial in therapeutic settings, where mindfulness is integrated with other treatment modalities to help clients manage their thoughts and emotions more effectively. This integration is instrumental in treating various psychological conditions by helping clients become more aware of their thought patterns, disengage from negative cycles, and approach their experiences with acceptance and compassion. Overall, mindfulness is presented as a versatile and beneficial practice that supports mental health and cognitive function, proving effective in both clinical and non-clinical settings. It aids in developing a healthier relationship with thoughts and emotions, promoting resilience and a more fulfilling life.